you very much. Over to you, Santosh.
Thank you very much, madam. Thank you very much. You very rightly said, madam, but there's not only the scientists. This day is, and its meaning is celebrated, everyone from the researcher and to the engineers also. So for in this series, in this program, now I request our past president, Professor Manju Sharma, madam. As we know, that we need not also into any introduction for madam and for her significant role in the several institutions building as well as the academy in particular and in the science and society for the country. She was the president of the National Academy of Sciences, India, and also the Indian Science Congress Association. Madam has well recognized for her manifold significant contribution, particularly for the welfare of women, who regarded as the role model. Not only for the women, for all the scientific fraternity, Madam is the role model. And Madam has served as the Secretary Department of Biotechnology in the Ministry of Science and Technology. And most recently, she was the Executive Director of the Indian Institute of Advanced Research in Gandhinagar, Gujarat. Madam is still very active, and presently Madam is guiding us as the Nasi New Initiative Chairperson, Nasi New Initiatives, and also the honorary scientist associated with the National Academy of Sciences. Madam has been honored with the numerous awards. She has received a Lifetime Achievement Award from the Biospectrum and Padma Bhushan by the Government of India in 2007. May I humbly request to Madam to kindly give your introductory remarks. Madam has said not inaugural address, but I request you, Madam, to kindly deliver your talk as a blessings to us. Over to Madam Manju Sharma, Madam.
Namaskar and very good morning to all the very distinguished Nasi fellows, members, students, and other scientists who have assembled here, Professor Anurag Sharma, Dr. Kamboj, Dr. Renu Saru, Professor Madhurika Agarwal, Dr. Jaipal Mittal, and many others. First of all, I would like to convey my heartfelt greetings to Nasi and others who have joined this program for celebrating the National Technology Day. A truly great achievement and an important day for India. Science and technology interventions are very critical for the living being, particularly the mankind. And we know that the basic requirements of human being in terms of food, health, agriculture, environment, energy, livelihood security, all these are dependent on the efforts in science and technology. So one is talking of the total innovation chain, starting with the basic research, coming up to the product and technologies, which we can deliver for the welfare of human beings, and also for their more comfortable life and ways of living, etc., etc. Today, we are on the roads of for Atmanirbhar Bharat, products, processes, new technologies, etc., and also the overall development in the country as per the dream of our Prime Minister. So we are all working towards that. And I would like to just very briefly touch upon some policy issues which have been very important for our country and for the growth of science, not only for growth of science, but also for the application of science and technology in general for the benefit of the humankind. After independence, there were several policy statements which were made for promotion, development, utilization, progress of science and technology in the country. And they were generated from time to time as integral part of the functioning of the government and major government operations. These policy statements were used for that. In 1958, we had the first scientific policy resolution, SPR as we always refer to, And then came the very important technology policy statement in 1983 and a technology policy implementation committee. Later on, in 2003, the then government was thinking that should we look at the science policy resolution in terms of what has happened in India all these years and what else do we want. And accordingly, a science technology policy statement was also formulated. Later on, the science, technology, and innovation policy. The word innovation was added to this policy statement in 2013. And that became a very important issue because after that we have a National Innovation Council, and the word innovation has assumed its significance in terms of awards, recognition, delivering goods to the people, etc., etc. We have, I believe, a new science, technology, and innovation policy resolution coming up 2020, but I don't know in what form it is at the moment in the country. We must also remember that it was really the scientific policy resolution which was promulgated with the approval of the parliament, and the objective of this resolution was, I quote, to foster, promote, and sustain by all appropriate means the cultivation of science and scientific research in all its aspects, pure and applied and educational, unquote. And this, that is why when this resolution was again examined, looked at by the scientific community during 2000 period, 90s and 2000, by and large, the scientists felt that this resolution is so compact, so robust in itself. And if we can implement this in its total spirit, it will do a lot of good for the country. This particular resolution resulted in the establishment of a Department of Atomic Energy, a Defense Research and Development Organization in 1958, and fourth Department of Atomic Energy in 50s. Then the Space 1972, Electronics 71, and Science and Technology again in 71. Then came a very major area for the development of this country on which there was a lot of focus, and that was in 1986, the birth of the Department of Biotechnology. And also the Environment Department in 80s was very, very important. Science and technology and scientific temper were considered so important that they were included in the Constitution of India. And that is, I think, a very significant feature of this. Now, a historical move at that time by the scientific community and the then Science Advisory Committee to the Cabinet, as also the Cabinet Committee on Science and Technology, the CCST, Government of India, a technology policy statement was there. During 1980s, it was a feeling that the strategic and front-running technologies became increasingly difficult to obtain. And although India had constructed a very strong base for science and technology, for industrial research also, agriculture base, but along with that, a really qualified pool of scientific manpower. But at that same time, there was a feeling that we need to get some technologies from outside. But that was a period of technology denial. And therefore, during that period, what the government felt, I'll just quote, attainment of technological self-reliance, a swift and tangible improvement in the conditions of weakest sections of the population, and the speedy development of backward regions. This was a statement, Government of India. And therefore, based on all these presumptions, the technology policy statement was announced in 1983, which became a very important statement for the country. And several programs, Technology Development Board was set up in the TST. With that, there were Technology Policy Implementation Committee and many other, different patent regimes. CSIR was really asked to implement the technology policy statement in a major way because of the industrial research component in them. And this statement became a very, I would say, a very strong base for the government to move further. We should also note that it is during this period that the technology was also impacting on the economic growth of the country. And this policy statement during that period became important because of that denial of technology and also because industry became interested in the R&D efforts. That was the most important feature at that time. And that was the first time that we saw that so many industries were coming forward and started doing R&D. Gradually, very gradually, it has grown further, and I'll come to that point. Of course, Dr. Renu Sarup will highlight that in terms of BIRAC, etc. So now I come to the main theme of today's event, that is the National Technology Day. As Madhulika has already said, 11th May is celebrated as the National Technology Day to commemorate the testing of Shakti-1 nuclear missile. This day also marks the flight of Hansa-3, the first indigenous aircraft of India developed by the National Aerospace Industries. It so happened that India was having a strong technology science base, but at the same time, with the emphasis of more and more indigenous development, and the classic example of Department of Atomic Energy, which shows the whole world that this is one area in which India has indigenous self-reliance. So we really were moving forward, although slowly, but on a sustained basis on the technology path. And in 1998 and 99, under the Operation Shakti, the government successfully conducted 3 nuclear tests on May 11th, 1998 at the Indian Army's Pokhran testing range. And again, at the same time, on May 13th, under the leadership of late President Dr. APJ Kalam, who is called the missile man of the country, Dr. Kalam, India conducted 2 further nuclear tests, establishing India as a member of the privileged club of nuclear powered nations. This was a very important period at that time. Then the Defense Research and Development Organization, they also developed the indigenous aircraft, the Hansa-3, and successfully test-fired Trishul missile on the same day. So therefore, what we feel that on the May 11th, 1999, our Honorable Prime Minister, Shri Atal Bihari Vajpayee, the then Prime Minister, declared May 11th as Technology Day because there were major achievements for the country. They were recognized, and also the celebrations were there all over the country, especially amongst the scientists and technological committee. It was a day of great rejoice for the country, I would say, but since then we have seen that National Technology Day has been observed by the scientific institutions, universities, and many academic institutions all these years. And we have had many technological breakthroughs in S&T, both in physical and biological sciences. Coming to NASI, NASI didn't stay behind while the country was progressing on this path. So NASI, in collaboration with and with the help of Reliance Industries, instituted NASI Reliance Awards. Very important. What for these awards are given to the young scientists? Young scientists, those who do technology-oriented research. Technology-oriented research, they have some products, they have some technologies which have gone to the market. There are some patents available to them. So this young and emerging scientists who are interested in technological growth of the country are given this NASI Reliance Young Scientist Awards. Very important step NASI took. You will get more details in the life science area by Dr. Renu Sarup. But with the birth of DBT in 1986, there were several awards instituted. And I remember one very clearly when during that period, we gave on the National Technology Day the award, not the award really, but the announcement for the leprosy vaccine. A very important, I'm sure Renu will remember, a very important development for the country. Leprosy vaccine, which was developed by the National Institute of Immunology. And this was announced on the Technology Day. And a vial of a box of containing several vials of leprosy vaccine, which was a very serious problem, which was a social stigma at that time. This box was given to the then health secretary, presented by me to the health secretary. And it marked really a very important day for the Department of Biotechnology, that after being established in 1986, in that period, it could bring out a vaccine. And that too for a disease which was becoming a very difficult problem for the country. So the latest about vaccines and diagnostics, Renu will give in her address. But then we have not remained behind when we look at the last 2-3 years during COVID-19 pandemic. And we have been able to control and cure the disease. And both vaccines and diagnostics, we have had great success. 2 indigenous vaccines have already been rolled out and being extensively used. More than 198 crore people have been vaccinated. These vaccines are also exported. So with the progress of the nation in science and technology, its values, advantages have been noticed, have been recognized both by the government in the form of technological self-reliance and also by the people of India. That's the most important, by the people of India. And it has been possible, now I won't say to a great extent, but it has been possible also to take the technological benefits to the grassroots, especially through the agriculture technology, in which again India has developed marvelous techniques, and we have become self-sufficient. We are exporting food today, and this is all because the Green Revolution, the new technological revolution, the Gene Revolution, all these are accounted for. So it is agriculture technology base, industrial technology base, and overall technological platforms, many large number of technology incubators, and the growth of biotechnology in the country. All this has shown us that India is very truly on the path of Atmanirbhar Bharat. I also want to say here that one important point which I forgot I want to mention here is the during the COVID-19 pandemic, when we were all very worried and there was this vaccine hesitation because many people were not willing to take the vaccine, Nasi again had a very major program, a network of program on more than 32 webinars were organized. Very eminent people, including Dr. V.P. Kamboj, Dr. Katoj, Param Bhargav, and large number of young scientists, Raghavan from Indian Institute of Science, Bangalore, and most importantly, Professor Padmanabhan, who was our president during that COVID period. They have all given lectures, and they have not given scientific lectures or for the development of vaccine. But what they have done is to create awareness about the COVID appropriate behavior. That is the most important thing. And the 32 webinars of NASI have done that. And the last point I want to mention here, that NASI also went ahead and instituted 2 awards. One for outstanding work done in the field controlling the disease, looking after the patients, and this was given to the AIMS, Dr. Neeraj Nishchal. And the second one was Pragya Yadav, and from NIV, where the virus was isolated for the vaccine. She got the award for her outstanding research contributions in this area. So the point I wanted to make was NASI has not been just watching all these things, the COVID pandemic. It has been actively involved in prevention, creating awareness, etc., etc. Not only NASI alone, but in collaboration with the Department of Biotechnology, thanks to Dr. Renu Saru, and thanks to Dr. Param Bhargav, in collaboration with Indian Council of Medical Research. So I conclude with a quote from our late Prime Minister, Atal Bihari Vajpayee, because it was he who this day, National Science and Technology Day, and he said, our aim should be to make India a global R&D hub. And this he had said at many occasions. Our aim should be to make India a global technology hub, R&D hub. And one very successful, most eminent scientist of this country, the Nobel laureate, Professor C.V. Raman, also gave a lot of emphasis in his very different lectures to the technology development. And while addressing the Madras University convocation in 1942, he said, the success of technology and practical education rests essentially on the existence of the universality of a strong school of basic sciences. He was always emphasizing on this, a strong school of basic sciences. So we can celebrate the National Technology Day because our country has many laboratories, many very eminent scientists who are engaged in hardcore basic research. And I would like to congratulate NASI once again, and not only NASI, but all the staff of NASI who are every year celebrating, helping us to celebrate the National Science Day. A great day for them. Thank you.
Very much for showing the informing us about the enormous contribution of the patriotic scientist as well as the significant achievement of our country. Actually, this day is celebrated in order to present and showcase the advancement made in the field of science and technology by our country. Very rightly, madam. Many thanks to you for your kind address. So, in the next proceeding for the next further program, further series, I request for the keynote address, Professor V.P. Kamboj sir. Actually, this lecture will be also considered as the PC Ray Memorial Lecture Award. And this address will be the part of this PC Ray Memorial Lecture Award. Actually, the National Academy of Sciences has give many of the Memorial Lecture Awards, and this award was instituted by the Academy in 2018. And this award have carrying a 50,000 cash prize, citation, and gold medal. We generally organize this program, this memorial awards in a grand way in the physical mode, but due to this pandemic issues, we are celebrating here, and this program has been concluded with the National Technology Day. The earlier recipients of this memorial award were great scientists like Dr. A.V. Rama Rao from the Evira, and Professor Animesh Chakravarti from the Indian Association for the Cultivation of Science, Kolkata, and the earlier, just in 2020, Professor Syed Hasnain, the Vice Chancellor from the Jamia Hamdard University, was the recipient of this award. I request our Executive Secretary, Dr. Neeraj sir, to kindly introduce the Professor Kamboj sir and invite him for the talk, sir.
Thank you, sir.
सोच इसकी जरूरत क्या है?
Sir, just to introduce, because some people have joined and they are new to the academy, so that is why we like to introduce you, sir. And basically, sir, this also we wanted to introduce the award itself also, because Professor Praful Chandra Memorial Lecture Award, which was instituted on a stance or on the request of Professor M.C. Chattopadhyay ji here in the Allahabad University. And this award was, it is so fortunate that this academy has been founded by Professor Meghnasa, and Professor Praful Chandra was Guru of Professor Meghnasa. So it was very befitting in this manner that we should have the award in the name of the Guru of Professor Meghnasa also. When Praful Chandra, especially on this National Technology Day, we would like to say or add that Praful Chandra was the first to start the chemical industry in this country. So this, by the way, this award becomes very important on this very day. And regarding Professor Kamboj sir, actually he is the past president of this academy and a very renowned scientist of this nation. He was the director of the CDRI, and he has worked with the WHO and many other associations and apex bodies of the Department of Science and Technology, Department of Biotechnology, and others. And Professor Kamboj sir has played a key role in the development of centroproman, which was actually at that very time, it was first non-steroidal oral contraceptive, which was introduced by Professor Kamboj sir and his team when he was in the CDRI. After retirement also, he took over the position of the chairman of the Bharat Immunological and Biologicals Corporation Limited, BIPCOL, as well as he is also the chairman of the board of directors, BCIL. Sir has contributed a lot to this development of science in general and the academy in particular. We are very much grateful to you, sir, and we request you very humbly to say a few words on this occasion and deliver this address, very prestigious address. Thank you, sir.
Thank you very much, Neeraj. Professor Anurag Sharma, acting president of the academy. Professor Manju Sharma ji, past president of the academy and the first women secretary of any science department of our country. And because of the encouragement to biotechnology in all the science departments of the country, I can say कि भारत में सभी लोग खाना खा पा रहे हैं, फल खा पा रहे हैं और स्वस्थ है। ये इसी वजह से जो इस देश की टेक्नोलॉजी डेवलप हुई और बायोटेक्नोलॉजी ने इसे बहुत थ्रस्ट दिया आगे, और मंजू जी ने इसमें बहुत मेजर रोल प्ले किया है। और अभी जो देश ने टेक्नोलॉजी में उन्नति की है वो मंजू जी ने अभी आपको बतला दिया, तो उस क्षेत्र में मैं कुछ नहीं कहूँगा। मैं सीधा मैं एकेडमी को ग्रेटफुल हूँ कि मुझे स्विच टू डेस्कटॉप एप्लीकेशन कि मुझे आचार्य पीसी रे मेमोरियल ओरेशन से ऑनर किया। और मैं इसमें जो बोलने जा रहा हूँ, आचार्य जी का जो विजन था कि इंडिया ड्रग्स एंड केमिकल्स जो हर्बल से हो, मॉडर्न हो, पर्सनलाइज्ड मेडिसिन से हो, उसमें सेल्फ सफिशिएंट होना चाहिए। आपको पता होगा सभी लोगों को कि आचार्य जी एक बहुत ही उस जमाने की मशहूर फैमिली हरीश चंद्र रे जी और भुवन मोहिनी देवी जो तालुकदार की बिटिया थी 2 अगस्त 1861 में राउडली कतीपरा गांव जो आजकल बांग्लादेश में उसमें पैदा हुए थे। और इनके पिताजी ने वहाँ बहुत बड़ी लाइब्रेरी मेंटेन की हुई थी और यंग आयु में ये इन्हें कलकत्ता भेज दिया ताकि ये स्कूल एजुकेशन और यूनिवर्सिटी एजुकेशन कलकत्ता में ही ग्रहण करें। और स्कूलिंग के बाद ये प्रेसिडेंसी कॉलेज में गए और प्रेसिडेंसी कॉलेज में इन्होंने एमएससी केमिस्ट्री किया और उसके बाद वहीं फैकल्टी में दाखिल हो गए। उसके बाद इन्होंने को गिलक्रिस्ट अवार्ड मिला जिससे ये इंग्लैंड में पढ़ने एडिनबर्ग यूनिवर्सिटी पढ़ने के लिए चले गए और वहाँ से इनको डीएससी डिग्री भी मिली। और आचार्य जी को फादर ऑफ इंडियन केमिस्ट्री कहा जाता है क्योंकि फर्स्ट केमिस्ट्री डिपार्टमेंट जो देश में प्रेसिडेंसी कॉलेज कलकत्ता में एस्टेब्लिश हुआ वो आचार्य प्रफुल्ल चंद्र रे जी ने एस्टेब्लिश किया। तो ये फर्स्ट इंटरनेशनली राउंड साइंटिस्ट ऑफ इंडियन ओरिजिन है। वो काहे से क्या हो गए, इन्होंने जो डिस्कवर द स्टेबल कंपाउंड मर्क्यूरस नाइट्राइट इन 1896 और ये लैंडमार्क डिस्कवरी थी उस जमाने में और उसके लिए इनको सर की उपाधि यानी कि ब्रिटिश ऑर्डर ऑफ द ब्रिटिश एम्पायर तो नहीं था, ऑर्डर ऑफ द इंडियन एम्पायर इनको दिया गया तो उससे सर की उपाधि। लेकिन आचार्य जी ने हमेशा ही अपने नाम के आगे ना प्रोफेसर लगाया और ना ही डॉक्टर लगाया, आचार्य ही कहा जो कि प्रोफेसर का इंडियन ट्रांसलेशन है। और इन्होंने फर्स्ट फार्मास्यूटिकल कंपनी जैसे अभी बतलाया गया इंडिया में 1901 में बंगाल केमिकल्स एंड फार्मास्यूटिकल वर्क्स लिमिटेड एस्टैब्लिश की। आचार्य जी देश के बहुत ही जाने माने केमिस्ट थे, एजुकेशनिस्ट थे, हिस्टोरियन थे, इंडस्ट्रियलिस्ट थे और फिलैंथ्रोपिस्ट थे। मैं ये आचार्य जी की आपको यंग पीसी रे की और आचार्य जी जब देशभक्तों के साथ काम करते थे तो लोग इन्हें कहते थे कि साइंस क्यों नहीं, इससे आपकी साइंस इफेक्ट हो रही है। आचार्य जी कहते थे कि साइंस इंतज़ार कर रही है लेकिन स्वराज जो देश को मिलने का है वो इंतज़ार नहीं कर सकता, तो इसलिए वो उसमें रहते थे। तो आचार्य जी का विजन था इंडिया शुड बी सेल्फ सफिशिएंट ड्रग्स और केमिकल्स में हुए और ये विजन इंडिया ने अचीव कर लिया ड्रग्स और वैक्सीन में। लेकिन केमिकल्स, बायोकेमिकल्स और एक्टिव फार्मास्यूटिकल इंग्रेडिएंट्स जिनसे ड्रग्स बनती है उसमें अभी तक हम नहीं कर पाए। आप सभी लोग जानते हैं कि इंडिया को फार्मेसी ऑफ द वर्ल्ड कहते हैं क्योंकि 20% जो जेनरिक ड्रग्स है इंडिया दुनिया में सप्लाई करता है। इंडिया थर्ड इन प्रोडक्शन है लेकिन 14th इन वैल्यू है क्योंकि जो ड्रग्स जो बेचता है बहुत ही सस्ते दामों में, तभी जो भारत में ड्रग्स की वैल्यू है वो 1/10 ऑफ द कॉस्ट पाकिस्तान, श्रीलंका या बाकी देशों के निर्भर में देखें। लार्जेस्ट प्रोड्यूसर ऑफ वैक्सीन है, meets 62% of global demand और exports to 130 countries, meets 70% of UN supplies and 2-3 बच्चों में से 2 बच्चे जो है दुनिया भर में भारत में बनी हुई वैक्सीन लेते हैं। हम लोग कहते हैं कि हमने जो है हर्बल ड्रग्स में बहुत तरक्की की है, लेकिन अगर आप देश की मार्केट देखें हर्बल ड्रग्स, आयुष ड्रग्स जो भी है वो $1 बिलियन है यानी कि 1000 करोड़ के स्लाइटली ऊपर। और आयुष ड्रग्स और हर्बल फूड्स की क्या मार्केट है ये कहीं आपको पता नहीं चलता। और गांव में जो जड़ी बूटियों से मार्केट है उसका भी कहीं रिकॉर्डेड नहीं है। दुनिया की जो आजकल 2020 में हर्बल ड्रग्स की मार्केट है वो नियरली $99 बिलियन है और हर्बल फूड्स की मार्केट जो है $201 बिलियन और ग्रोथ 14.5% है। और इसमें इंडिया की जो अपने कंजप्शन की मार्केट है वो $1 बिलियन है टोटल। लेकिन हम क्या आयुष ड्रग्स की और हर्बल फूड्स की जो एक्सपोर्ट है उसके बारे में भी कोई फिगर्स नहीं है और देश में क्या कंज्यूम हो रही है उसे। मॉडर्न मेडिसिन की जो ग्लोबल फिगर है मार्केट है 1270 बिलियन है और ग्रोथ 4 to 5% है। इसमें इंडिया की काफ़ी कंट्रीब्यूशन है। मैंने कहा 20% ड्रग्स इंडिया से जाती है और इंडिया जो है $4 बिलियन के करीब ड्रग्स बनाता है जिसमें लगभग $2 बिलियन एक्सपोर्ट करता है और बाकी हमारे देश में उसी की वजह से सभी लोग स्वस्थ हैं। और ट्रेडिशनल मेडिसिन को कहते हैं इंडिजिनस एंशिएंट ट्रेडिशन, जो अल्टरनेट मेडिसिन के नाम से पुकारा जाता है। और इसका है कि होलिस्टिक थेरेपी, यानी कि सब तरफ से ट्रेडिशनल मेडिसिन के जितने वैज्ञानिक रहे हैं वो ये चाहते हैं कि आप सेहतमंद रहे। उनका विचार था ए हेल्दी माइंड इन ए हेल्दी बॉडी इन ए हेल्दी एनवायरनमेंट। कि हेल्दी माइंड तभी रह सकता है जब भी आपका शरीर हेल्दी हो। अप्रोच थी कि आप बैलेंस्ड खाना खाइए, फिजिकल एक्सरसाइज करिए और योगा करिए, और कोई बीमारी होने, इन्फेक्शन ना होने दीजिए, और हेल्दी एनवायरनमेंट में रहे। और ज़्यादातर ये यूजफुल है क्रोनिक डिजीज, मेटाबॉलिक एंड डिजेनरेटिव डिसऑर्डर्स के लिए। ट्रेडिशनल मेडिसिन जो है वो हमारे जो पुराने फिजिशियंस थे, जैसे चरक और सुश्रुता, उनके 100 और इनके जैसे और हंड्रेड्स ऑफ इयर्स ऑफ एक्सपीरियंस पे बेस्ड है। वो फोर रनर ऑफ नेचुरल प्रोडक्ट ड्रग्स जो आज आज आप देख रहे हैं, जहाँ हर्बल मेडिसिन जो है प्राइमरली 1, 2 और 3 प्लांट एक्सट्रैक्ट्स या फार्मुलेशंस है, लेकिन आयुष प्रोडक्ट्स जो है इसमें तो 5, 6, 7, 8, 9, 10 कितने प्लांट भी हो सकते हैं। टेस्ट बेस्ट सेलिंग ड्रग्स आप हर्बल की देखें तो इसमें 7 भारत में नंबर जो 1 पे है कालमेघ, नंबर 2 पे गार्लिक, नंबर 3 में टर्मरिक। ये दुनिया भर में बिकती हैं, लेकिन इनकी क्या मार्केट है, हर्बल ड्रग्स की मार्केट इंडिया की किसी को नहीं पता। और घृत कुमारी भी बहुत बिकती है, एफेड्रा, साइबेरियन गिंजिंग या हर्बल ड्रग जो तुलसी है या करौंदा, 8 हैं। अगर इन्हीं को हम लोग स्टैंडर्डाइज करके इंटरनेशनल मार्केट में ले जाए तो आप बहुत बड़ी मार्केट आ सकती है। अगर आप देखें कि अर्लीस्ट डॉक्यूमेंटेड यूज जो ट्रेडिशनल ड्रग्स का है अबाउट 5000 ईयर्स अगो है। ऋग्वेद में, अथर्ववेद में मेंशन्ड है, चरक संहिता और सुश्रुता संहिता में भी है। इंडिया की बहुत लार्ज बायोडाइवर्सिटी है और 800 प्लस जो है उनका डॉक्यूमेंटेड यूज है ड्रग्स के लिए। 70% ऑफ पॉपुलेशन is using Ayurveda, Siddha and Unani medicines in India, and it's believed that world over around about 60 to 7% population in rural areas is dependent upon the indigenous systems of medicine. These are culturally acceptable world over. लेकिन इनमें ज़्यादातर ड्रग्स जो है एज रिलेटेड, मेटाबॉलिक और इम्यून डिसऑर्डर्स के लिए। अगर आप तुरंत फ़ायदा चाहते हो तो ऐसी ड्रग्स इसमें नहीं है। अगर आप हर्बल फार्मुलेशन जो इंडिया में है उसमें देखें, त्रिफला जो है, हरड़ बेड़ा आंवला, 219 फार्मुलेशंस में यही है। और अगर आप मुलट्ठी देखें जैसे जस्टी मधु, 141 फार्मुलेशन में ये है। और पाइपर लौंगम जो है, जो लौंगम, पाइपर लौंगम जो है काली मिर्च, लाल मिर्च कहते हैं इसको, काली मिर्च जैसी की वैरायटी है। और वसाका जो है ये 110 फार्मुलेशन में। अगर इन्हीं को स्टैंडर्डाइजेशन करके हम लोग इंटरनेशनल मार्केट में ले जाए तो यही बहुत बड़ी मार्केट है। लेकिन इसमें सबसे बड़ी जो कमी है, अगर आप पेरिस गिंजिंग जो हालांकि कोरिया से मार्केट हो रही है, इंडिया से नहीं हो रही, उसमें भी 6 गुना ज़्यादा लेवल 25 से लेके 150 ग्राम तक वेरिएशन है। और ये जो होली बेसल है गिंजिंग, साइबेरियन गिंजिंग, इसकी आप देखिए 5-10 माह लेके रफली 300 से 320 यानी कि 60 गुना वेरिएशन है। तो क्या है बोतल में ये कोई नहीं जानता, अनलेस के इनको स्टैंडर्डाइज किया जाए तभी इंटरनेशनल मार्केट में जा सकती है। लेकिन कल्चरल हेरिटेज का ये है, एशिया और अफ्रीका में सभी इन ट्रेडिशनल मेडिसिन में बहुत रिलाई करते हैं। और जैसे मैंने पहले बताया 70 to 75% ऑफ वर्ल्ड पॉपुलेशन जो है अपने इमीडिएट जो बीमारी होती है उसके लिए इस्तेमाल करते हैं, दोनों डेवलप्ड और डेवलपिंग कंट्रीज़ में भी। डेवलप्ड कंट्रीज़ में हेल्थ फूड्स के लेते हैं और डेवलपिंग कंट्रीज़ में ड्रग्स। और इस प्रिस्क्रिप्शन ड्रग्स एंड यूज जर्मनी जो है 39% है इनका, फ्रांस में 29% है, इटली में 7%, यूके में 4%। और जो इनको इंडिया से जाते हैं उसने जो मेजर डैमेज किया, जो हमारे भस्मास हैं, मर्करी के भस्मास, कैडमियम, उनका सेफ्टी का कोई डेटा नहीं है। और अरिस्टोलोकिया इंडिका एक ऐसा पर जिसकी टॉक्सिसिटी मिली बाहर जाके, तो उसलिए हमारा मेजर डैमेज हो गया। इवन यूके में जहाँ पहले ये एक्सेप्टेड था, अब वो सारा सेफ्टी डेटा चाहते थे। और यूएसए में हेल्थ फूड्स जो है 16% बिकती है। अब भारत का उसमें क्या कंट्रीब्यूशन है वो बड़ा मुश्किल है बतलाना, कि कोई रिकॉर्ड वर्ल्ड वाइड इंटरेस्ट है इसमें और WHO भी इसे प्रमोट करना चाहती है। सिर्फ इसको आप सेफ्टी और एफिकेसी एस्टेब्लिश करने की ज़रूरत है। और कंपैरेटिवली मॉडर्न मेडिसिन जो है ये एक्सपेरिमेंट ड्रिवन है लेबोरेटरी से, टारगेट और एक्टिविटी जो है इसमें वो वैलिडेटेड है, कहा सेफ्टी भी इसकी इंश्योर्ड है, कहाँ काम करती मोड ऑफ एक्शन और क्लिनिकल एफिकेसी क्लिनिकल ट्रायल से एस्टेब्लिश है, कंट्रोल्ड बाय रिजिड रेगुलेशंस बहुत है जो इसके है। और जब लुइस पैस्चर ने वैक्सीन की डिस्कवरी की थी उन्होंने कहा था लेबोरेटरीज आर सेक्रेड डोमेन्स, दीज आर द टेम्पल्स ऑफ द फ्यूचर वेल्थ एंड वेल बीइंग। और यहीं पर जो ह्यूमैनिटी ग्रो करेगी, अच्छी होगी और इम्प्रूव करेगी, और ह्यूमैनिटी इसी के थ्रू ही प्रोग्रेस कर सकती है। इंडिविजुअल हार्मोनी जो है वर्क्स ऑफ नेचर है। पंडित जवाहरलाल नेहरू जी ने भी कहा था जो लेबोरेटरीज है ये नए मॉडर्न इंडिया के मंदिर है, और इसमें मैंने ऐड कर दिया कि इनको ज़्यादा जितनी ज़्यादा होंगी उतनी ही देश की इकोनॉमिक सिक्योरिटी आएगी। लर्न ऑल यू कैन, नेहरू जी ने कहा था आप जितना भी सीख सकते हो एंशिएंट यानी एग्जिस्टिंग नॉलेज और मेडिसिन और सर्जरी से सीखिए, लेकिन ये मत मानिए कि इनमें लास्ट वर्ड थाउजेंड्स ऑफ ईयर्स अगो पहले ही कहा जा चुका है। द लास्ट वर्ड हैज ऑलरेडी बीन सेड, दैट्स व्हाट आई हैव एडेड टू दैट। पहले जो दवाइयाँ जो थी उनके बायोमार्कर्स होते थे होलिस्टिक, जैसे ट्रेडिशनल रेमेडीज, होलिस्टिक मेडिसिन, स्वीट यूरिन के यूरिन जब आप जाते थे यहाँ वहाँ चींटियाँ और चींटे अट्रैक्ट होते थे, उसको उससे माना जाता था कि आदमी को डायबिटीज़ है। उसके बाद थोड़ा सा और एडवांस हुआ तो फिर ग्लूकोज डिटर्मिनेशन हो गया। मॉडर्न मेडिसिन में इंसुलिन डिटर्मिनेशन और ग्लूकोज सिंथेस काइनेज एंजाइम 3 का हुआ, और मॉलिक्यूलर मेडिसिन में जीन और माइक्रो एरेज से आप डिटेक्ट करते हैं डायबिटिक है कि नहीं। अगर आप लीड जनरेशन का इनोवेशन देखें तो ऑब्जर्वेशन एंड नेचुरल प्रोडक्ट्स बेस्ड द सिंथेसिस टेस्टिंग इन वीवो प्री 1970 से पहले इसी में होता था। उसके बाद आ गया क्वांटिटेटिव स्ट्रक्चर एक्टिविटी रिलेशनशिप, मॉलिक्यूलर मॉडलिंग, सिंथेसिस एंड स्क्रीनिंग ऑफ कंपाउंड्स and natural products and testing them in vitro and in vivo, that is pre 1970 to 1990। combinatorial chemistry and high throughput screening, यानी कि बहुत कंपाउंड आप हजारों की तादाद में बनाओ और स्क्रीन करो, ये 1990 या 2000 के बीच में डेवलप हुआ। और अब जो है कॉम्बिनेटोरियल केमिस्ट्री, प्रोटोमिक्स और वर्चुअल स्क्रीनिंग 2000 ऑनवर्ड से, और साथ में जीन्स, मोनोक्लोनल एंटीबॉडीज और रिकम्बिनेंट डीएनए as lead generations। virtual screening होती aims at avoiding synthesis, that is what I have told you कि combinatorial chemistry से आप बहुत ज़्यादा बना सकते हो। जहाँ बहुत ज़्यादा कंपाउंड कहीं भी पड़े हैं किसी डेटाबेस में भी है, उसको आप वर्चुअल स्क्रीनिंग में हाई थ्रूपुट स्क्रीनिंग के थ्रू आप टेस्ट कर सकते हो, और एक दिन में 100,000 कंपाउंड्स आप इससे टेस्ट कर सकते हो। सिंगल मॉलिक्यूल जो है सफिशिएंट टू आइडेंटिफाई आप पहचान सकते हो that were very different structurally लेकिन show similar biological activity। ये पावर है। ये देखिएगा इसमें जो है आप शुरू से जो टारगेट स्पेसिफिसिटी टेस्टिंग करना शुरू करते, अगर स्ट्रक्चर 2 डायमेंशनल है तो बहुत ज़्यादा आएंगे, 3 डायमेंशनल है कंपेरेटिवली, अगर 4 डायमेंशनल स्ट्रक्चर आप अवेलेबल है तो आप वर्चुअली ड्रग के पास ही पहुंच गए। और स्ट्रक्चर जनरेट कैसे होते हैं कि एक तो लाइब्रेरी से जो है देखते हैं, लिटरेचर और पेरेंट से आप बायो इन्फॉर्मेशन से इमीडिएटली आप ढूंढ सकते हैं, और फिर आप देखते हैं कौन सा मोटिव जो है स्ट्रक्चर जो है वो बहुत कॉमन है इन सब में, उससे आप हिट्स और लीड्स पे या लिगेंड डिज़ाइन करते हैं। मैंने वो था 2 डायमेंशनल, 3 डायमेंशनल, दिस इज द 4th डायमेंशनल, तो उससे आप हिट्स लीड्स या एंडोजिनस लिगेंड है जो प्रोटीन बॉडी में प्रेजेंट है उससे, या कीमोजिनोमिक्स है उससे, या पौधों से स्क्रीनिंग करके आपको बहुत, और रैंडम स्क्रीनिंग होती है लैपटॉप के थ्रू, या कॉम्बिनेटोरियल केमिस्ट्री के आप हजारों कंपाउंड बना लेते हैं और उनको आप टेस्ट कर सकते हैं हाई थ्रूपुट स्क्रीनिंग से। इनसे लीड जनरेट होती है, और जितनी देर लीड जो हिट है वो जनरेट नहीं हुई आप आगे ड्रग डेवलपमेंट नहीं कर सकते। अगर आप हर्बल टू मॉडर्न मेडिसिन और फाइटोफार्मास्यूटिकल देखें, 60% ऑफ 870 स्मॉल मॉलिक्यूलर एंटिटीज इंट्रोड्यूस इन वर्ल्ड मार्केट जो है 1981 से 2002 तक नेचुरल प्रोडक्ट्स यानी कि प्लांट ड्राइव थी, और 11% ऑफ द 252 WHO एसेंशियल ड्रग्स है वो भी प्लांट ड्राइव्ड है।
हाई इम्पैक्ट इन कैंसर एंड मलेरिया, लेकिन मलेरिया में कोई अभी तक एस्टेब्लिश नहीं हो पाई एक्सेप्ट जो चाइनीज मेडिसिन है, उसके अलावा एल्कोलॉइड्स, टर्पिनॉइड्स, स्टीरॉइड्स, ग्लाइकोसाइड्स, अगर इनकी मार्केट देखें जो $30 बिलियन तो इन्हीं की है। और हिंदुस्तान में कई चीज़ें जैसे करकुमिन का टर्मरिक है से करकुमिनॉइड्स वो मार्केट हो रहे हैं, और बाकी चीज़ें जो है बिना सेफ्टी किसी की, हर्बल मेडिसिन की जो मार्केट दुनिया भर की अभी है $90 बिलियन है, और हिंदुस्तान की जो रिकॉर्डेड मार्केट है वो 1 बिलियन है, यानी कि 1000 करोड़ है। हेल्थ फूड्स की 400 to 650 बिलियन मार्केट है, और मैंने कहा था 40 to 15% ग्रोथ है इसकी, और इंडिया में हेल्थ फूड्स की मार्केट का किसी को कोई नहीं पता। मॉडर्न मेडिसिन की 1270 बिलियन है, और इसकी ग्रोथ जो है हेल्थ फूड से कम है, 4 to 5% है। अवेलेबल थेराप्यूटिक टारगेट्स जो आप कहते हैं सब ड्रग्स के हैं लेस देन 500 मॉलिक्यूल्स है, तो ये न्यूक्लिक एसिड से एंजाइम्स, जीपीसीआर और हाई सक्सेस रेट जो है विद अमाइनोजेनिक GPCRs, then G protein coupled receptors, then large peptide receptors. 600 genes encoding GPCRs identified from human gene sequencing, और 1000 genes के GPCRs बिलीव करते हैं, तो और कई टारगेट डिस्कवर करने, और रिसेप्टर्स जो है टोटल 45% ड्रग टारगेट्स है, जिसमें जी प्रोटीन कपल्ड रिसेप्टर्स ही 30% है, एंजाइम्स 28%। हार्मोन्स इसलिए हमने आपको ये दिया। और अगर आप देखें मॉलिकुलर ड्रग टारगेट्स जाएं तो अगस्त 2002 में देखें तो 8610 टारगेट्स थे, और अक्टूबर 2007 इन ए स्पैन ऑफ 5 years 8,663,000 यानी कि 350 ड्रग्स टारगेट्स पर डे। और उसके बाद और कोई भी जो है बिना वैलिडेशन के ड्रग टारगेट कहता है, कोई भी प्रोटीन नहीं आई, और 2017 में 20,000 ड्रग टारगेट्स पर डे। तो जो टारगेट्स का पहले कहते थे उसमें लोगों को बिलीफ ही बंद हो गया। और अगर आप मॉलिक्यूलर टारगेट्स देखें जो FDA अप्रूव्ड ड्रग्स है 2006 तक, टारगेट्स अप्रूव्ड फॉर ड्रग्स जो है पैथोजेंस या ह्यूमन को मिला के देखें तो 324 है सिर्फ, और ह्यूमन जीनोम में जो टारगेट्स है ह्यूमन में 268 है। और कैसे मैंने आपको पहले दिखाया कि अराउंड 20,000 टारगेट्स पर डे ही आपको निकाले जा रहे थे 2016 में। टारगेट्स अप्रूव्ड स्मॉल मॉलिक्यूलर ड्रग्स पैथोजन और ह्यूमन का मिला ले तो 248 है, और सिर्फ ह्यूमन का 207 है। थेरापेटिक एंटीबॉडीज़ के लिए ह्यूमन के 15 और बायोलॉजिकल्स के लिए बोथ पैरासाइट और ह्यूमन के 76, यानी कि टारगेट्स उतरे नहीं है। और जीन साइलेंसिंग मॉलिक्यूलर मेडिसिन, एक दफ़ा जीन साइलेंसिंग पे बहुत डिपेंडेंस हो गई थी और एंटीसेंस मॉलिक्यूल्स के, लेकिन इस सारे एरिया में अभी तक जो है वन ड्रग आई है पेटिसिरेन, जो टारगेट करती रेयर कंडीशन दैट कैन इम्पेयर हार्ट एंड नर्व फंक्शन। तो ये एरिया इतना फ्रूटफुल नहीं दिया। अगर मॉलिक्यूलर मेडिसिन का फ्यूचर देखो तो ये ड्रिवन होगी जीनोम से, प्रोटियोम, मेटाबोलोम, काइनोम मॉलिक्यूलर टारगेट्स, मोनोक्लोनल एंटीबॉडीज एज ड्रग्स, प्रोटीन्स एज ड्रग्स, स्मॉल मॉलिक्यूल्स एज ड्रग्स, एंटीसेंस पेप्टाइड्स। हालांकि कोई अभी तक इसमें वो मिली नहीं सिवाय एक ड्रग के, लेकिन फिर भी बिलीव, और जीन साइलेंसिंग मॉलिक्यूल्स एज ड्रग्स ये भी बिलीव किया जा सकता है। क्रिस्पर कैस आने से जीन साइलेंसिंग में शायद तरक्की हो, जीन थेरेपी और इम्यूनोथेरेपी, लेकिन डिटरमिन करेगा कौन सा एरिया आगे बढ़ेगा। इकोनोम जैसे बाकी सब, ये तो इकोनोम आ गया, जैसे इकोनॉमिक्स वालों ने कह दिया। हर्बल टू मॉडर्न टू मॉलिक्यूलर एंड पर्सनलाइज्ड, हर्बल मेडिसिन, होलिस्टिक थेरेपी, प्लांट डिकॉक्शंस, प्रेपरेशन, एक्सट्रैक्ट्स, क्रूड मिक्सचर्स टू थ्रेट, ये पुराने ज़माने की जितनी ट्रेडिशनल मेडिसिन है सभी इस पे। मॉडर्न मेडिसिन है सिंथेटिक कंपाउंड और फाइटोकेमिकल बेस्ड टू ट्रीट डिजीजेज। मॉलिक्यूलर पर्सनलाइज्ड मेडिसिन बेस्ड ऑन जीनोमिक प्रोफाइल ऑफ एथनिक पॉपुलेशंस और ग्रुप्स। पर्सनलाइज्ड मेडिसिन सिर्फ इम्यूनोथेरेपी में आ सकती और किसी एरिया में नहीं आ सकती। अगर आप इकोनॉमिक्स ऑफ ड्रग डेवलपमेंट देखें, लीड सिलेक्शन में 10,000 कंपाउंड्स 4 से 5 साल और $580 मिलियन खर्चा करके आपको कुछ लीड्स मिलती है, और प्री क्लिनिकल में जो है 10 से 20 है, 1.5 साल में $1.5 मिलियन करके ये नैरो डाउन। फेज़ 1 क्लिनिकल ट्रायल में 5 से 10 कंपाउंड, और फेज़ 3 तक जाते जब 1 to 2 रह गए, और जब FDA या किसी ड्रग रेगुलेटरी एजेंसी को अप्रूवल करते तो एक ड्रग रह जाती है और उसमें टोटल समय लगा 2017 में 12.5 ईयर्स लगता था और 2.6 बिलियन डॉलर्स का खर्चा था। लेकिन अब जो है 2021 में खर्चा कुछ कम हुआ है और डेवलपमेंट पीरियड भी थोड़ा सा कम हुआ 10 to 12 ईयर्स और खर्चा जो रह गया अब 50% रह गया 1.3 बिलियन। और ये हुआ कि बायो इन्फॉर्मेटिक्स का मेजर रोल आ गया। और यदि आप देखें कि इंडिया ने इस एरिया में मॉडर्न ड्रग डेवलपमेंट में ग्लोबली क्या, स्मॉल पॉक्स वैक्सीन 1796 में आई, अभी तो मैं आपसे 12 साल की बात कर रहा था, और ये 0 ईयर पहले जो टेस्ट किया गया काउ पॉक्स किया गया, उसके बाद स्मॉल पॉक्स की वैक्सीन की गई, सक्सेस मिली तो 0 ईयर में आ गए। एस्प्रिन जो आज तक भी बहुत ही सबसे ज़्यादा यूज़ होने वाली ड्रग है, 1899 में डिस्कवर हुई और ये भी 0 ईयर में बिना कोई टॉक्सिसिटी और फार्माकोलॉजी। पेनिसिलिन 1941 में जब वर्ल्ड वॉर 2 थी, ये 6 महीने में सिर्फ रैट्स टेस्टिंग के बाद ये सीधी ही ह्यूमन टेस्टिंग में चली गई। तो इतने लोग उस वक्त इंजर्ड थे तो सीधे जाता था। ओरल कंट्रासेप्टिव जो 60 से पहले आ गए वो 1 साल के अंदर आ गए। और अब उसी वक्त जो था 1961 में तो एक ड्रग ऐसी आई थैलिडोमाइड, जिससे ये हो गया कि जो बच्चे पैदा होते थे जो प्रेग्नेंट लेडीज ने लिया वो फिश के फ्लिपर्स जैसे उनके थे। तो उस वक्त से ड्रग रेगुलेशन जो 0 से 1 ईयर में हो रहा था तो वो 15 साल में चला गया। इंडिया ने दुनिया भर में प्लेग को कंटेन हो गया। स्मॉल पॉक्स एलिमिनेट हो गई 1978 और गिनी वर्म एलिमिनेटेड 2010 में, रिंडरपेस्ट एलिमिनेटेड 2009 में, पोलियो एलिमिनेटेड 2015 में, डिप्थीरिया रूबेला वर्चुअली एलिमिनेटेड, मैटरनल एंड चाइल्ड मॉर्टेलिटी मिनिमाइज। और मंजू जी ने अभी ऐड किया था लेप्रोसी जो है, जो NIA की वैक्सीन आई उससे जो है लेप्रोसी भी वर्चुअली एलिमिनेटेड है। और साथ का थेरापेटिक वैल्यू ये हुई कि कानपुर देहात में जहाँ ट्रायल हुए वहाँ TB भी डाउन आ गई। तो ये कहते बिलीव किया जा सकता है कि जो लेप्रोसी की वैक्सीन है इनकी वो कम करती है TB भी आल्सो। यदि आप न्यू केमिकल आइडेंटिटीज और न्यू मेडिकल इंट्रोडक्शन देखें 1995 से तो अबाउट 37 पर ईयर न्यू ड्रग्स आती थी और 4 बायोलॉजिकल। उसके बाद 2001 से 5 साल में तो कम से 37 से कम होकर 24 न्यू ड्रग्स आ गई इंक्लूडिंग 4 बायोलॉजिकल। और 2007 से 2011 तक और कम हो गई 21 न्यू ड्रग्स। लेकिन 2017 में 14 और 15 में फिर थोड़ा सा बूस्ट गया। 2016 में फिर 22 न्यू ड्रग्स और 7 बायोलॉजिकल्स। लेकिन 2017 से ऑनवर्ड्स आजकल 40 to 50 न्यू ड्रग्स आ रही हैं। 12 बायोलॉजिकल्स है अभी, +2 सेल थेरेपीज और +1 जीन थेरेपी भी आ रही। अगर आप डेवलपमेंट प्रोफाइल देखिए 1 out of 10,000 कंपाउंड जो है आपने जो स्टार्ट किए एक दवाई बनती है। 3 जो है अप्रूव्ड ड्रग्स है वो डेवलपमेंट कॉस्ट जितनी आई वो कवर करती है। और इनमें से भी जो अगर एक ड्रग 3 में से वही जो अपना रेवेन्यू मीट करती है, कॉस्ट ऑफ प्रीवियस फेलियर्स को मीट कर सकती, वही मार्केट होती है, बाकी तीनों मार्केट नहीं होती। और न्यू मॉलिक्यूलर एंटाइटीज कॉस्ट मैंने आपको बताया 2.6 बिलियन डॉलर है, लेकिन 21 में कम आई 1.3। और R&D एक्सपेंडिचर बोथ पब्लिक एंड प्राइवेट सेक्टर का पर ईयर देखा जाए तो भारत में और दुनिया भर में 1.2 ट्रिलियन डॉलर्स एक साल में होता है। और ये सारा सरकारी पैसा और प्राइवेट इंडस्ट्री खर्च करती। हेल्थ केयर इंश्योर्ड बाय स्मॉल मॉलिक्यूलर ड्रग्स एंड वैक्सीन सो फार। अगर आप बायोसिमिलर्स देखें तो भारत ने जो है प्रोटीन थेरापेटिक्स जो है बायोसिमिलर्स, जिसको DPT ने बहुत इनकरेज किया, ये बनाते हैं और इसकी एक्सपोर्ट इंडिया एट द मोमेंट जो है 98 ड्रग टेक्नोलॉजी इनके पास बायोसिमिलर्स की है और 50 जो है मार्केट में है, इंडिया में भी है और बाहर भी है। और मोर देन 50% बायोसिमिलर्स जो यहाँ बनते हैं वो एक्सपोर्ट होते हैं। और यूरोपियन यूनियन में जो बायोसिमिलर्स हालांकि इन्होंने डेवलप किए लेकिन वहाँ जो पहले मार्केट हो गए थे 2015 से वही रहे, उसके बाद इन्होंने अप्रूव ही नहीं किए। US began approving biosimilars in 2017। इन्होंने डेवलप किया शुरू में लेकिन अपने देश में अप्रूव नहीं किया, एक्सेप्ट जो शुरू में डेवलपमेंट में हो गए। और इंडिया के जो ये 10 जो रेयर डिजीज है इनके लिए 10 ये और 9 ये इंडिया में भी यूज होते हैं और डेवलपिंग कंट्रीज को एक्सपोर्ट होते हैं और आजकल तो यूएस और यूरोप में भी ये एक्सपोर्ट हो रहे हैं इंडिया से। लेकिन अगर आप देखें तो 2017 हेरल्ड द बिगिनिंग ऑफ पर्सनलाइज्ड मेडिसिन सेल एंड जीन थेरेपी, जिसके बारे में पर्सनलाइज्ड मेडिसिन में जब हमने कैरियर स्टार्ट किया था अपना 60 में, उस वक्त भी पर्सनलाइज्ड मेडिसिन के बारे में बात करते थे, लेकिन कोई पर्सनलाइज्ड मेडिसिन डेवलप नहीं हो पाई। अगर आप अब भी देखें स्टेम सेल थेरेपी, यूएसए ब्लड फार्मिंग स्टेम सेल्स जो कि हिमोपैथिक प्रोजेनेटर सेल्स, फैट स्टेम सेल से, अम्बिलिकल कॉर्ड ब्लड से, जब बोन मैरो सेल से निकाले जाते हैं, 80 कैंसर में इस्तेमाल हो चुके हैं। इंडिया में कोई लॉ नहीं विच गवर्न्स द यूज ऑफ स्टेम सेल्स। आईसीएमआर गाइडलाइंस है कैसे जो होने चाहिए, लेकिन इसके बावजूद बहुत ही अनअप्रूव्ड ट्रीटमेंट्स भी चल रही। जो अप्रूव्ड ट्रीटमेंट 4 मार्च 83 में टाटा कैंसर सेंटर में बोन मैरो ट्रांसप्लांट टू ट्रीट ल्यूकेमिया, उसके बाद से काफ़ी हो चुके हैं। इसमें 60 to 80% सक्सेस रेट है। और एक कंपनियां इंडिया में जो स्टेम सेल बनाती है सेल लाइन से, वो स्टेम क्यूटिक्स, और कॉस्ट जो है इंडिया में 5 से 25 लाख है। और कोई भी जो है सेंटर जो है बोन मैरो सेल्स निकाल के विदाउट आइसोलेटिंग दी स्टेम सेल्स और ट्रीटमेंट में यूटिलाइज कर रहे हैं। ये अनएथिकल यूज बहुत ज़्यादा है। और स्टेम सेल अप्रूव्ड यूज है जो है ये तो 10 कैंसर्स के लिए है, फेशियल रिंकल्स, सीडेड गम्स, डैमेज्ड कार्टिलेज के लिए, लेबर कंजेनिटल, ये रेटिनल डिसऑर्डर है, और स्पाइनल मस्कुलर एट्रोफी है, ये एफडीए अप्रूव्ड है। और CAR T सेल थेरेपीज जो रिसेंटली हुई है, थेरेपीज आर अप्रूव्ड फॉर अबाउट 20 कैंसर्स के लिए, जिसमें मोस्ट इम्पॉर्टेंट है एक्यूट लिम्फोसिटिक ल्यूकेमिया जो ब्लड कैंसर होता है, और लिम्फोमास। इंडिया में एक ट्रायल अभी टाटा एट्रिक ने 4 जून 2021 को डीबीटी की सपोर्ट से स्टार्ट किया है। और कैसे क्रिस्पर कैस सेल्स टेक्नोलॉजी कैसे डेवलप होती है, ये जो कैंसर है, कैंसर की कौन प्रोटीन स्पेसिफिक है उस सेल के लिए, उस प्रोटीन को आइसोलेट करके वो काइमेरिक एंटीजन रिसेप्टर बनाया जाता है जो टी सेल्स पे लोड कर दिया जाता है। और जो टी सेल जो ही कैंसर सेल को डिटेक्ट करते हैं उन्हें मार देते। और दूसरा एडेड जो होता है, जो टी सेल रिकॉग्निशन वाली प्रोटीन बनती है उसको रिमूव करते हैं क्योंकि वो इंटरफियर ना करे। और तीसरा जो एडिट होता है, जो जीन जो है जिससे टी सेल्स इम्यून रिस्पॉन्स कैसे सेल्स बनते हैं उनको प्रिवेंट करती है ताकि वो रिकॉग्नाइज कर पाए और कैंसर सेल्स को डिसेबलिंग कर सकते। और फिर ये वापस बॉडी में डाल दिए जाते हैं इंजीनियर टी सेल्स, कैमेरिक एंटीजन रिसेप्टर और टी सेल्स, और ये इम्यून स्पेसिफिक है, डिटेक्ट्स कैंसर सेल्स एंड किल देम। ये जो होता है, आप पेशेंट का ब्लड निकाला जाता है एफोरेसिस से, ब्लड सैंपल्स को जो उससे टी सेल्स एक्सट्रैक्ट होते हैं, और उसमें जो स्पेसिफिक एंटीबॉडी जो एंटीजन है बॉडी में कैंसर सेल का, उसको आइसोलेट करके टी सेल्स के ऊपर लोड कर दिया, तो ये जो कैमेरिक एंटीजन है ये फिर मल्टीप्लाई करके वापस दे दिया जाता है पेशेंट में। तो ये थेरेपी जो अभी तक इसमें डेवलप हुई है, CAR सेल थेरेपीज डिफरेंट कैंसर्स के, यस कार्टा अप्रूव्ड इन सितंबर 2017, दिस इज फॉर लार्ज डिफ्यूज बी सेल लिम्फोमा। लेकिन काइमेरिया उसके बाद जो सितंबर 2017 में ये भी आ गई, दिस इज फॉर एक्यूट लिम्फोसिटिक ल्यूकेमिया एंड डिफ्यूज बी लार्ज सेल लिम्फोमा ऑफ ऑल टाइप्स। उसके बाद 2019 में हुई हार्मोन रेजिस्टेंट प्रोस्टेट कैंसर के लिए। फिर मल्टीपल माइलोमा जो एक बहुत ही भयानक कैंसर है उसके लिए 2021 में, और फिर फरवरी 2022 में। और इन सब का 6 तो ये अप्रूव हुई, लेकिन इनकी जो है 10 डिफरेंट टाइप ऑफ प्रेपरेशन जो मार्केट में है। लेक्सटुर्ना न्यू जीन थेरेपी फॉर इनहेरिटेड विजन लॉस, ये रेटिनल डिसऑर्डर है, लेबन कंजेनिटल एमर्जेंसी। 3 डोजेज दी जाती है, तो 21 बच्चों को और अडल्ट को दी गई, लेकिन 93% इफेक्टिव इन इम्प्रूविंग विजन इन ऑल विद यंगेस्ट 8-year-old शोड बेस्ट रिजल्ट। और ये जीन थेरेपी जो थी क्रिसमस 2017 में मार्केट हो गई। इसमें ये है कि जब बच्चा पैदा होता है उनका विजन नॉर्मल होता है, लेकिन 2 साल से लेकर 8 साल तक वो बिल्कुल डिटेरियोरेट करते हुए ब्लाइंड हो जाता है। अगर ये डोज दे दी तो 93% इफेक्टिव, और जितना जल्दी दोगे उतनी जल्दी बच्चे की रिकवरी बहुत अच्छी है। और इसकी कॉस्ट जब ये डिस्कवर हुई थी 14 to 15 करोड़ रुपीस थी, और अब ये घटते घटते जो है करंट कॉस्ट जो है 4 to 5 करोड़ रुपीस है। अगर ग्लोबल मार्केट और मॉडर्न मेडिसिन कंट्री वाइज कंजप्शन देखा जाए तो सारी ड्रग्स जो है, तभी लोग यूएसए की मार्केट को इसलिए भागते हैं कि 2020 में 45% ड्रग्स जो दुनिया भर में प्रोड्यूस होती है वो यूएसए अकेला कंज्यूम करता है, जबकि उसकी पॉपुलेशन है भारत से 1/6 पॉपुलेशन है, और बाकी ये यूरोप 30%, और जापान जो है छोटा सा कंट्री 7% मेडिसिन कंज्यूम करता। चाइना और इंडिया जो वर्ल्ड की लार्जेस्ट पॉपुलेशन, चाइना 8% कंज्यूम करती है, इंडिया जो है सिर्फ 1%। हालांकि इंडिया प्रोडक्शन में 20% ड्रग्स प्रोड्यूस करता है वर्ल्ड की, और फार्मेसी ऑफ द वर्ल्ड है, लेकिन कंजप्शन देखिए यहाँ पर तो 1% है, यानी कि $2 बिलियन के बराबर आप ड्रग्स कंज्यूम करते हैं। और टोटल सेल्स जो है $916 बिलियन, और यूएसए ने जो था अभी आप देखें तो 33%, $322 बिलियन, हमने अब 45%। टोटल सेल्स करेंटली जो है यूएसए 572 बिलियन, उनका 1.2 बिलियन से, यानी कि 45% अकेला कंट्री कंज्यूम करता है। और वर्ल्ड की लार्जेस्ट पॉपुलेशन जो है वो इंडिया और चाइना कंबाइन कर दे तो 9%, और रेस्ट ऑफ द वर्ल्ड 9%। बाकी अगर आप यूरोप और यूएस जो डेवलप कंट्रीज देखें तो 75% ड्रग्स तो यही कंज्यूम कर लेते हैं। मॉडर्न मेडिसिन बून हुआ या कर्स हुआ सोसाइटी के लिए। 1850 की फिगर्स हमें नहीं, लाइफ एक्सपेक्टेंसी नहीं मिल पाई, लेकिन 1950 जब भारत इंडिपेंडेंस हुआ था 1947 में, तो एज एक्सपेक्टेंसी जो थी 32 थी, 1950 में 38। जो ही इंडिया सेल्फ सफिशिएंट ड्रग्स में हो गया तो अब जो एज एक्सपेक्टेंसी है 69.7 ईयर्स है एवरेज, और जिसमें लेडीज़ की 1 या 2 साल ज़्यादा है आदमी से। और चाइना में जो है हमारी कंपेरेटिवली 76.6 ईयर, यूरोप में 77 ईयर्स, यूएसए में 76 ईयर्स, सबसे ज़्यादा एज एक्सपेक्टेंसी जो है 85 ईयर। तभी मैंने आपको बताया था कि यूएस एक, चाइना, जापान एक छोटा सा कंट्री जो है 8% दुनिया में जो दवाई बनती है वो कंज्यूम करता है। तो इसलिए आप ये कहीं मॉडर्न मेडिसिन बून है कि कर्स है, लेकिन डेफिनेटली बून रहा एज वेल एजिंग इज कंसर्न, क्योंकि जब आप इंडिपेंडेंट हुए थे हमारी जो एवरेज एज थी वो 30 ईयर्स थी, लेडीज़ की 32 और आदमियों की 27। तो डिपाइज द ब्रिटिश इंडिया की ड्रग कॉस्ट इतनी थी यहाँ पर कि हमारी एज एक्सपेक्टेंसी बढ़ी ही नहीं, अब जबकि बढ़ के जो है नियरली 70 ईयर्स के करीब हो गया। धन्यवाद।
बहुत बहुत धन्यवाद सर। आपने इस हमारे जो आज के नेशनल टेक्नोलॉजी डे कार्यक्रम में, और साथ ही साथ प्रोफेसर पीसी रे मेमोरियल अवार्ड के अंतर्गत चिकित्सा के क्षेत्र में भारत की उपलब्धियां, और साथ ही साथ हमारी प्राचीन जो चिकित्सा पद्धति और आधुनिक चिकित्सा पद्धति, दोनों को आपने जिस तरीके से सर यहाँ पर हम सभी को नरेट किया, हमारे सभी के लिए, जो हमारे न्यू रिसर्चर्स हैं उन सभी के लिए ये डेटा आगे के लिए भी बहुत काम आएगा और इस पर वो रिसर्च कर सकते हैं। मैं डॉक्टर नीरज सर से अनुरोध करूंगा कि कृपया प्लीज सर पीसी रे मेमोरियल लेक्चर अवार्ड का साइटेशन प्रोफेसर वीवी कंबोज सर के लिए पहले रीड आउट करें।
Many thanks, sir. Actually, this lecture was summarizing every aspect of the Indian indigenous development of the medicines, as well as its trial, its standardization, quality control, safety, efficacy, validation, and everything. That it was a lecture which must be published. Actually, we have a fashion also to publish such prestigious lectures in our science letters. So it was so comprehensive that I would like to request first Professor V.P. Composer to send this article so that we could publish it in the science letters for the wider dissemination. The other thing is, of the very beauty of this lecture was, it was a complete sketch of the whole of our ecosystem, eco-medicine system, which has developed in this country with our indigenous facilities regarding the proteomics, metabolomics, eugenics, and everything. So it was a very nice lecture, sir. Professor, I would like to request you to please send this lecture to us so that we could publish it. Now, I would like to read the citation. Professor P.C. Ray Memorial Lecture Award has been conferred to Professor Ved Prakash Kambosa, former Director, CSIR CDRI Lucknow and Chairman, Board of Directors, BCIL New Delhi, for his outstanding research contributions in the area of drug development. So the award money and medals will be sent to you, sir, later on. But we are very much grateful to you for delivering, for sparing time for such a beautiful lecture, sir. Thank you very much, sir.
Thank you, Neeraj.
Chalo, Santosh.
Thank you, sir, and thank you, madam. Just in order to this program, the next theme address will be delivered by respected Dr. Renu Sarup, madam. As we have now, in order to recall and reaffirm our faith in the technological advancement, and the theme of this year for the National Technology Day was given by Department of Science and Technology was integrated approach in science and technology for sustainable future. And the theme address will be given by our speaker, Dr. Renu Sarup, madam. Dr. Renu Sarup was the Secretary DBT and the Chairperson, Biotechnology Industry Research Assistance Council, BIRAC. As earlier told by madam also, madam is PhD in genetics and plant breeding. She was actively engaged in the formulation of biotechnology vision in 2001 and the National Biotechnology Development Strategy in 2007 and the strategy second. As the member secretary of the expert committee, madam was the member of the task force for women in the science constituted by the scientific advisory committee to the prime minister. Madam is known for her significant contribution for the DBT scheme on the biotechnology career advancement for women scientists, BioCare. Madam is the fellow of NACI and the recipient of many honors, including Biospectrum for the person for the year 2012 and the National Entrepreneurship Award 2017. And a very known as the newly discovered microbial species, Natrialba sarupa is in the honor of Madam Renu Sarup, madam, has been given in her honor, Natrialba alba. We are very much thankful to you for your kind consent for delivering this talk, and we invite you, madam, to kindly share your views on this day. Over to respected Renu Sarup, madam.
Thank you very much, Santosh, and thank you for this very kind introduction, respected Dr. Manju Sharma, all other senior dignitaries who are here, the past presidents, the current council members, Dr. Kamboj, the speaker for today's award lecture, Dr. Anurag Sharma, Dr. Madhulika Agarwal, everyone here. You can only see the grid, so I can't see too many faces and names. First of all, thank you very much for inviting me to deliver this very important theme address today on National Technology Day. This is one of the most important days for all of us in the science and technology field, and I do take this opportunity to convey my greetings to every science and technology person, to everyone in the society for this very important day. Madam Manju Sharma has so clearly outlined not just the theme or the whole purpose of us and the genesis with which we celebrate this technology day, how this technology day was identified by our former prime minister and given to us as a very important day where each one of us can look towards this day to bring forth all our technological advances. We all know that the boundaries between science and technology cannot be too distinct. Science has to move into technology development. What really is technology? It's basically the practical applications of any scientific knowledge for the welfare of humankind. Madam, in her opening remarks, very clearly outlined and gave us the details about the science technology policies, the science technology policy statement, each one of them which the government has brought in from these many years, starting from the immediately after independence till, as rightly said, the 2021, which is in draft stage, and we hope that it will be cleared this year. There is one very clear mention in each of them, and that is how do we move towards science and technology development for the welfare of mankind. And I think this welfare of humankind is what is the basis and the premises with which we take forward each scientific research and technology development. The National Technology Day, and as rightly said, is an opportunity for us to celebrate what strength India has in science and technology. The developments that we do to commemorate not just the technological advances, but also to commemorate and the contributions of our various scientists. And in this, we really look at the visionary leadership which our former Prime Minister Shri Atal Bihari Vajpayee ji and our former President Dr. Abdul Kalam made in giving this country not just the technological advancements, but giving this country an opportunity to be able to celebrate this very important day. I think with Dr. Manju Sharma's address, followed by Dr. Kamboj's address, we've already got a very good flavor of what the policy is in terms of technology development. And Dr. Kamboj brought out very clearly how technologies have been developed in the area of biopharma, in the area of drug development. What is important for us to now recognize is that based on what the theme for today's address is, integrated approach to science and technology for a sustainable future. What do we look at an integrated approach and how do we look at a sustainable future? I think what is important for us to understand is how science moves through the value chain of technology development. And yes, already mentioned by Madam Manju Sharma, innovation becomes a very key factor to it as we move through it. So now it's always science, technology, innovation that we talk about. Because without innovation, the whole purpose of taking science and technology forward would not be met unless and until we know what our aim is, we know what is it that we are looking forward to. India has, over these many years, and we are celebrating the 75th year of our independence, it's the Azadi Ka Amrit Mahotsav. We have tried to document very clearly what we've done in all these years. And clearly, even if you look at the science technology policy documents, or you look at our technology development, we have moved a long way from where we were when we got independence. Even our policy statements brought out very clearly this change, where initially we were talking about seeing how we could acquire technologies, build capacities for acquiring technologies. Then it moved to how we could become self-reliant in technologies. And today, India is a preferred partner for co-development of technologies. No longer are we just receivers of technologies, we have become co-developers of technologies. But what is important is with this co-development of technology, with the strength that we have been able to get in technology development, what are we seeing as our endpoint? Any technology that is developed must have a societal impact. And it is that societal impact, whether we talk about technologies which impact the rural sector, whether we talk technologies which have a huge commercial market, both within the country or outside the country, each one of them is impacting society. And what better opportunity did we get to showcase our technology strengths than the COVID itself? Yes, leprosy was our vaccine, was our first major achievement, which gave us not just the leprosy vaccine, but it gave us the confidence that we can do it. If you see, and the whole area of life sciences and biotechnology, the foundations that were set in terms of building a strong ecosystem, which we now have our whole strong ecosystem, which gave us the opportunity to then take on important developments like COVID vaccines, COVID diagnostics.
Santosh, we can't.
Hello, madam. We are not able to hear you, madam. रेणु
आपके यहाँ से चला गया कि कहाँ से गया?
नहीं मैडम के पास से डिस्का वो दिखा रहा है मैडम पुअर कुछ नेटवर्क की प्रॉब्लम
नेटवर्क की कुछ प्रॉब्लम है फोन करके पूछ लो कि क्या
दिल्ली में तो नेटवर्क की प्रॉब्लम्स हमेशा रहती है
दिल्ली इज अ प्लेस ऑफ नेटवर्क्स देयर आर मेनी लेयर्स
या
Sorry, I got thrown out and suddenly in between. But technology also has these issues with it. That as we go and get dependent on technology, we need to keep pace with technology to see that we have alternate innovations. Am I audible now?
Yeah, madam. Yeah, very well.
Okay. Sorry, I just got thrown out for a minute. So what I was saying is that when we look at these various technological advancements and strengths, it's because we've been able to build this very, very strong ecosystem for ourselves. If you just try to look at the growth trajectory in which we have been able to build this whole ecosystem, I think while we look at how we've been able to develop our strength in technology, it's also important that we've kept pace with the scientific advancements. Whether it's the use of digital technologies, whether it's the use of technologies and things like genomics, which was just talked about, the whole omics revolution, whether it's the healthcare, whether it's the agriculture, whether it's climate change, clean energy. Today, we are at a field where they need integrated approach, not just in terms of multidisciplinary areas being brought about, but as I said, a very clear aspect to see how do we bring in innovation. What is it that technology is important for us now? Because it's all a global world. We're all looking at, we had a call during COVID from our Honorable Prime Minister on an Atmanirbhar Bharat. What is an Atmanirbhar Bharat? It's not just a self-reliant India. It's technologies that we develop for the country, which are also for the globe. And we've seen it. We've seen it happening in vaccines, where India has not just got vaccines for itself, but it's provided vaccines to the world. So any technology development that we look at, any technology sector that we do, it's important that the nation must have a competitive advantage. And that competitive advantage should be not just in terms of the needs it fulfills for its own country, but the competitive advantage it has in terms of acquiring global markets. And that is where innovation becomes very, very important. The impact of any technology is what is going to judge whether that technology really has been a technology which is successful. Just converting a science knowledge into technology is not important. It is the impact that technology is going to have, either in terms of the society it impacts or the market's impacts or the specific cause like we had for COVID this time. So the technology sector is one area in which when we are looking at a National Technology Day, we have to continuously, as I said, keep pace with the advancing science. You need to pursue your research applications. You need to look at what really are those human resource skills that you need to develop. And most importantly, a complete holistic development. How do you do that? It has to be with the participation of all who are engaged with it. And I think it was the Department of Biotechnology which very early on brought in the industry collaborations, whether it was the leprosy vaccine that Madam just spoke about, or the various drugs and other biosimilars that Dr. Kamboj spoke about. And yes, Department of Biotechnology was the first department in the country, in the government of India, to be able to create a system, to create a vehicle, to create a platform which supports startups and industries for a PPP model of research. The SPIR model was the first funding scheme that was started by the government, which then took shape at first as a scheme, and then of course we created an whole organization, BIRAC, and today we have a large number of schemes. So this is what we need to do to create an innovation ecosystem, which allows us to be able to look at technology development. So it's not just saying that, okay, we have scientific knowledge, we need to see how we can take it forward, we need to see how we convert it. But I think what is important is how do we create that ecosystem? If you look at moving in this particular direction, there is clearly a vision that we have for ourselves of creating a technologically empowered country for ourselves. But there are challenges. And these challenges of technology, which we have, development that we have faced in all these years, is moving the technology from the laboratory to commercial scale or to the field. How do you get that trust between academia and industry to get stronger? How do you help them to build these co-development partnerships? How do you deeply engage with industry in each of your missions that you're doing? And I think this is really what the Honorable Prime Minister also mentioned when he spoke about having an Atmanirbhar Bharat, where focusing more on research and development and creating PPP models. And as I said, who better than the Department of Biotechnology with its schemes with PIRAC has been there to demonstrate it. Now, if you look at the key components of an S&T robust innovation ecosystem, what are those key components? The DBT has been credited with creating a very strong foundation of biotechnology across the country. What is the key component of that foundation? It is definitely the capacities that we build, whether it is in terms of human resource or whether it's in terms of infrastructure. Today, across the country, if you look at any university, IITs, ICERs, medical colleges, the Department of Biotechnology has supported the human resource development programs. And we have programs which go right from the undergraduate star colleges to the doctoral and postdoctoral research. And of course, the cutting edge infrastructure that has been set up. Newer technologies, whether it's in the area of agriculture, you look at gene editing. We're so pleased that gene editing guidelines have now been brought out by the government. Again, an advancement towards technology, speed breeding, molecular characterization, all of those. In healthcare, you're looking at the whole platforms that we have for vaccine development, the biopharma shared infrastructure facilities, biorepositories, whole range of them. I won't even get into it because that itself will be a full talk about the ecosystem that is there. But what is important is having built all this, it was important for us to create a very, very strong and efficient policy and regulatory ecosystem. For any technology to be moving from science to technology development, for industry to be a partner with you to take it ahead, you need a very robust regulatory ecosystem. And for a field like biotechnology, it's a complex ecosystem. And I think the Government of India today has a very strong ecosystem. The Department of Biotechnology, working with the CDSCO, with the ICMR, has been able to bring out a large number of guidelines. And again, I refer to COVID, the vaccine development, the diagnostics. It happened because we could be recognized globally because of the strong robustness of our whole regulatory ecosystem. We then need to have very important technology transfer framework. Because if you're talking about technology development, the technologies need to be transferred. They need to move from academia to industry. The technology transfer framework was a weak point within our system, but I'm very pleased to say in the last few years, there has been a major focus on that. And in this major focus that has been given, we have created a robust platform for technology transfers. Dr. Kamboj himself has been part of many of these technology transfer ecosystems that we've created. We've built capacities now within the universities, within our research institutes, and the DBT, through its incubation centers, has created clusters of technology transfer offices, and we have a very good framework for that. The BCIL has played a very major role in this, working with many other agencies. As I said, nearly 20 of our incubators have set up excellent technology transfer framework offices. So that's important. If you look at any other technology development, the most key and critical aspect at the end is how do you commercialize and how do you market these products which come out? So creating a framework for marketing. And I think, again, the government, of course, is generally the preferred buyer for these technologies and products because they're all for public good. But then you have market incentives also which help. So the S&T ecosystem, the S&T innovation ecosystem, which we have built within the country now allows for that. The whole robust incubation system, the biotech parks that we've established, and connecting with the networks of investors have today been able to give us that opportunity where we could look at connecting our startups, because this is mainly now for the startups. The larger industries have very well organized marketing systems, and they of course need more of incentives in terms of their tax rebates, in terms of helping them to create manufacturing zones, creating manufacturing funds, which the government is doing, but it's technology development and they're working together. But I think today, if India is to look towards the future, if we have to look towards what our next step is, it's how do we scale up this whole startup ecosystem that we have set up, from the incubators to the accelerators. And now we have very interesting words like scalators, and we have technology clusters. We can just go on and on adding these. But I think what is important is the sustainability of these. For that, we need to have the technology resource center, that is our academic institutes, our universities, working very closely with these startups. The clusters that have now been set up, this is one very important aspect in it, where the startups and the industry do not sit outside, but they sit with the universities, with the industry, to see what is it that we can take up together as a co-developmental activity. Technology development, transfer, and commercialization. You cannot have the industry and academia moving in two parallel tracks, which never meet. Neither is it like a, sort of a relay race that, okay, we've closed, we hand over the baton and now you take it forward. No, there has to be an overlap. You have to move along together, and you have to see that together you identify what the gaps are and take it ahead. And I think the networks which have now been created through our incubators, through our accelerators, allow for this. India today is recognized not just for technology development within the country, but globally. In the clean energy area, we are very pleased that the clean energy incubator that we set up along with the Tata Power is today recognized in the 25 country mission innovation, and it has been recognized as the key incubation center for which today 7 countries are collaborating. We have 5 sister innovation hubs that we have created like this. And I think that is the power of technology development, where we could look at technologies which now not only help our own country, but they also help global challenges, look at what we could meet. Because COVID is again an example, climate change, antimicrobial resistance. These are all areas where we are not looking for solutions only for the country. We are looking for solutions which are there for the globe. And I think that now gives us an advantage to imagine what technologies for the future would be. Technology forecasting is critical. Working towards future technologies is important, but just identifying them cannot help us unless and until we focus on those key aspects that I spoke about just now, the capacities that we build, the cutting edge technologies that we keep in mind, and the collaborations that we keep on, whether it's industry, whether it is international. Unless we focus on these 3 C's, it will be very, very difficult for us to keep pace with the new technology development. India has huge opportunities. As I said, we've imagined a new India for ourselves. We've imagined a technologically empowered India. Sashakt Bharat is what we had put forward in the vision for 2030 that we presented to the Honorable Prime Minister. I was fortunate to have the opportunity to do that. But for this, we need to imagine. We need to imagine what would it be to look at newer opportunities that come to us. And at this, let me also conclude with 2 very, very important phrases, and that is When we launched our vision of biotechnology, and I'm so pleased that Madam Manju Sharma gave me the opportunity to be the member secretary with her for that first vision document with our Prime Minister Atal Bihari Vajpayee ji launched. And I still remember, Madam, when we had gone to the residence of the Honorable Prime Minister and that was launched by him, he made a very important statement and he said ITBT. ITBT is not information technology and biotechnology. It's India today and Bharat tomorrow. So BT he equated with the Bharat tomorrow, and very rightly said by Dr. Kamboj, if today we are looking at food, we are looking at healthcare, we are looking at our COVID response, we are looking at our the way India has tackled this whole vaccination program, it's because biotechnology has come forward. It's because today we have capacities not just to develop technologies, but we have technology platforms which exist. These technology platforms can be taken up for wide-ranging uses. How did we come up with an mRNA vaccine so quickly? Because we had a platform that allowed us to do it. This is really what we need to do. We need to look at it. Our former prime ministers gave us that statement of saying it is a Bharat tomorrow that we are looking at. And if I will close by saying and quote from Albert Einstein, who had said, imagination is everything. It is the preview to what is life is going to come up with, what the attractions or what attractive things are going to come up forward. So we just have to keep imagining. We just have to keep, and this is mainly a statement for the younger students who are hearing us today. Do not let your imagination just close. Let the curiosity in your mind go as higher, and because there's no limit to where technologies can be developed. It's an infinite limit. We can keep on and on. We can keep on and on innovating. And yes, India is moving up in the innovation index, but we need to be within the top few countries. And we can only do that if your imagination moves towards new technology development. So thank you very much. Greetings once again on the Technology Day, and wish you all many, many successes in new technology development. Thank you so much.
Thank you very much, madam. Many, many thanks.
Thank you.
Thank you very much, madam. Definitely, we are grateful for your kind blessings and giving the sparing your time, madam. Definitely, so madam, you has your significant contribution for the BIREC as well as for the your brainchild, the BioCare, are known for from lab to the laboratory to the industry is well known, and the society not only in the India, the whole country, the internationally these will be go on. We are very much thankful, madam. I think Madam Manju Sharma wants to say something, madam.
Why should I say something now? I think we should hear Professor Anurag Sharma, what he has to say. Renu has said everything rightly. Perfect.
So I request to Dr. Neeraj sir to kindly invite for the next presidential talk to Professor Anurag Sharma sir. Dr. Neeraj sir, I request you to sir kindly introduce our Vice President and presently officiating President of Academy to kindly introduce and invite him, sir.
Thank you, Santosh. Professor Anurag Sharma ji is presently officiating president of this one of the most prestigious academy and oldest academy of this country. And he is himself a renowned Indian physicist and a professor in the Department of Physics of the Indian Institute of Technology. He has published many papers in very renowned international reputed journals, and he has been conferred the Shanti Swarup Bhatnagar Prize, one of the most prestigious prize of India in the field of the science and technology. And also he has received many other prizes and awards. And he is elected fellow of all the three major Indian science academies, like INSA, Indian Academy of Sciences, and NASI, as well as the Indian National Academy of Engineering. For the academy, his contributions are enormous because right from his association with this academy since last decade, he is contributing a lot in the field work of the academy, especially the science communication. Actually, he is so active in the Delhi chapter that almost dozens of programs are organized every month or within a fortnight. So with this, I would like to invite Professor Anurag Sharma ji to say a few words as his presidential remarks.
Thank you, Neeraj. Dr. Manju Sharma, Dr. Professor Kamboj, Dr. Renu Sarup, Professor Madhulika Agrawal, Professor Ballare, fellows of the Academy, staff of the Academy led by Neeraj and Santosha. Thank you very much for giving me this opportunity. Good afternoon. So a lot has already been said about technology and technology development in the country and so on. I'll just say a few things about technology itself. So, the theme is integrated approach in science and technology for sustainable future. So, you can't separate technology and science and innovation, because innovation is nothing but new technology. I mean, you can, as I always say, that you can buy a technology, but you cannot buy a new technology. New technology has to be created, and that has to be done through innovation. And innovation will always require a support of science. So, science, technology, and innovation are, sort of parts of one triangle. One can't be separated from the other. The word, I was just trying to read somewhere that where did technology word came from, and how did it come into the being? And to my surprise, it's a very, very new word. It's only 150 years old or something like that. Because in the early part of the human history, uh, all the engineering or everything was called mechanical art, because art was taken as something which is created artificially, whether it is painting, whether it is something else. And so, like building a house or building a boat or all those things that is how it started. This mechanical art, it was called, till about, let's say, 19th century or so. Then in Germany, they started a word called technology, which basically meant the knowledge and the understanding of this mechanical art. And that is how this word came in. And then MIT was opened in the second half of the 19th century. Then in the US, the technology word was for the first time used. To my surprise, in MIT, the technology word was used for the first time in the US history, or science and technology history. Anyway, so that is how it came. And but always, social scientists would say technology is morally neutral. And Dr. Renusarup did talk about that technology we develop should be for the human welfare. And when it said it was morally neutral, actually when it was developed, people didn't bother whether it's good for the human being or it will be bad for the human being. And we have seen in the last 100 years or so, a lot of technologies which were developed probably for the welfare of the human being, but actually ultimately were used not for the welfare of the human being. Particular example being, and defense technologies, or let's say armament technologies, particularly, or nuclear bomb and things like that. But so today, one has to, as Dr. Renusarup said, one has to worry whether one has to see whether whenever we are looking at a technology, whether it's useful for the human welfare. And I think our own father of the nation, Gandhiji, had when he did talk about industrialization or technology in that sense, and he said that we should always, whenever we make something, whether it's a policy, whether it's a technology or anything, we should keep in mind the poorest of the poor in mind, whether it will benefit that person or not. And uh, that is something we lose sight of very often when we are doing, particularly when a lot of technologies in the second half of the 20th century developed in electronics or optoelectronics or information technology or biotechnology or many other technologies. Today technology is a word which is can be attached to anything and it becomes a technology. Uh, but the important thing I would say is that biotechnology particularly, and today's focus of our program has been on biotechnology, with all the three main speakers talked about that, can be said to be something which is sort of fulfilling this aspect, in the sense it is actually for always human behavior and looking at the last person in the poorest chain. I mean, when you develop a vaccine or a drug, it is actually for all. It doesn't sort of distinguish it, whether it will go to a rich person or to the poor person, whether it will, particularly vaccines like leprosy, it is to help the poor mostly. It's the same cannot be said for example, for all the smart technologies or automobile technology and so on, whether they are built for the poorest of the poor. But as far as the biotechnology is concerned, it is usually targeted, it is neutral in that way, and it is actually targeting all the humanity. And so in that sense, this technology is different from other technologies. Whether you call it information technology, you can make a labored point that it helps the poorest of the poor also in some sense or the other, but it's a very indirect way. But as far as the drugs and vaccination particularly, and this COVID, as point has been made already, has come out that it has helped the healthy poor, and this is very, very important. And Dr. Manju Sharma brought out NACI's role in these developments, particularly regarding during COVID and even earlier in technology awards and many other things. And NACI has been sort of doing this and will continue to do that. And I would like to congratulate the entire NACI community, including the staff, for supporting these kind of initiatives. Particularly, this program is being supported by the staff of NACI. So I would like to thank all of you and all the staff for coming up with this particular program. Thank you very much.
Thank you very much, sir. Thank you very much. And for sharing the views, as very rightly, sir, this on this day, not only to record and reaffirm the faith in the technological advancement, as Dr. Renu Suru Madam said also, that today we have to honor the enormous contribution of the patriotic scientists, as Madam told about the APJ Kalam. So here we are sharing all the views, but a lot of things to be said and a lot of things has already been said. But now we are going to concluding remarks. We request our General Secretary outstation, Professor J.S. Bellare, sir, to conclude the session for today's National Technology Day. Dr. Professor Bellare, sir, is the Institute Chair Professor of Chemical Engineering at the Indian Institute of Technology, Bombay. He is an elected fellow of several leading science and the engineering academies like NACI, INAE, and has been conferred several prestigious awards like Lifetime Achievement Award from the Government of India Ministry of Ayush. Sir has worldwide experience in the microscopy, biomedical devices, material and implants for regenerative medicines and nanotechnology, particularly nanomedicines spanning across various medical systems. Sir is a member of Research Council of and the committees of several leading institutions like CSIR, DBT, DST, and has also served on the board of directors, board of advisors for several companies. So may I request Professor Bellare, sir, to kindly share your concluding remarks on this very day, sir.
Thank you very much. It's been lovely listening to all of you. Professor Manju Sharma ji, beginning with a great overview of the history of this day, a recognition that began with defense but has had very wide ramifications. Professor Madhulika Agarwal, Dr. Kamboj, Dr. Renu Swarup, Dr. Anurag Sharma, the staff of NACI. So it's been a fantastic experience. My main impact that I see of all these efforts, and they have been wonderful efforts in which many of you have played key parts, is on the youth of today. Today's graduating student looks upon innovation and startup as a way of life, which was unimaginable perhaps a couple of decades or even a decade ago. And that's because of all that has happened and has been so nicely described by Dr. Renu Swarup. And this transcends achievement. It's not just graduates who are doing this. There is an effort at the grassroots level to do these incubation and bring them out, inject technology at grassroots levels, recognize them and translate them. It transcends age. I see many who have retired from service and then join or even form their startups. And this is really something that is new, that has happened over the last few years. And this is thanks to the change in environment, the risk-taking ability that we used to shirk when I was a youth. But today, I see today's youth eager to do that, not just youth, but even I am tempted to try and do some of these technologically risky things in trying to translate some of the scientific efforts that we all have been involved with. Yeah. Our youth today is very sensitive to IP issues. I'm surprised sometimes when I ask my student to publish a paper. She asks me, maybe I should run this through my IP cell and make sure that we filed whatever IP is there. And that's the key recognition of the impact of technological translation that is going to happen. Institutions also have got good IP policies and tech transfer uh, uh, methods to ensure that technology can indeed be translated. I think we really need to examine at the national institutional level some of these issues which still dog us, and that is some period of exclusivity, exclusive licensing, and the possibility of longer term arrangements, complete buyout of patents. These will definitely help in better translation and commercialization. But I see wonderful future ahead, and my thanks to all speakers today for a wonderful overview. And let me pass this now on to Dr. Neeraj to close this event. Over to you, Neeraj.
Thank you, sir. Thank you for beautifully summarizing the things in a very nutshell with the actually contributions of all the distinguished speakers. Actually, if we go through the whole event, the event started with Professor Madhurika Agrawal's welcome remarks, which was itself a very comprehensive in the sense that she gave the overview of all the things which are going to happen. And it was not only the welcome remark, but it was also the guidelines for the new generation, what we should do. And then Madam Manju Sharma ji, I can't say about her. She is an icon of this academy. But her taking the narrative steps of the technology, especially the technology policies of India, and then correlating it with the advancements as well as with the contribution of this academy in the sense of the COVID awareness and all those things. Actually, very remarkably, she defined all the steps which were taken by the Indian government for the technological advancements with the help of the different technology policies, which were actually the landmarks at the time of their inception. And especially regarding the STI policy, which she described in 2000, which was in 2013. This academy played a very key role there also, because under the direction of Professor M.G.K. Menon sir, Madam Manju Sharma ji and others, actually at that very time a promise was organized to review the whole policy, STI policy, and that policy decisions were sent to the government of India, and Madam beautifully drafted that also. And it is also, even present day, it is also on our website, the STI policy, innovations policy, all that. So we are very much thankful to Madam because she guides her at every step, and we take the things forward with her able and very valuable guidance. Thank you, Madam. Thank you very much. After that, the lecture which was delivered by Professor V.V. Kamboj sir, the past president of this academy, as well as the former director of the CDRI. His lecture was so comprehensive and it was so systematic that I must tell about a few points about that. He started with the herbal formulations and all those things, then standardization, then quality control, then safety and efficacy, then validation, and all these things were stepwise. Everything was very clearly defined, that how India has done well in this regard and how the steps were taken to make the India self-sufficient in the field of Indian drugs, in the development of the Indian drugs and the medicines, especially even the contraceptives and vaccination and diagnostics and all those things. So it was very good lecture, sir. We are very much thankful to you, sir. And we request you for once again for the script of that so that we could publish it. Then the lecture which was delivered by Madam Renu Sharumji, the former secretary to the Government of India, Department of Biotechnology, and the DSC also. Her science and technological ecosystem which she defined, and the biotech park and BIORAC and biocare role and all those things in integration of the development of the science and technology in India and the involvement of the youth. It was remarkable, a comprehensive approach to say the things in a very a small time and in a very crisp manner. She defined everything what the India could do and what it has done in a very crisp manner. We are very much thankful to you, madam. And then Professor Anurag Sharma ji, our officiating president, technology development, its ethical things and the biotechnological role in all those things, and how this session was dedicated to the biotechnological advancement. He has defined everything in a well coordinated manner, that how we should take the biotechnology also and how it is very much beneficial, especially regarding this COVID, is the role of the vaccines which was played, and India's self-sufficiency in developing the vaccines and all that. So, and in the end, the summing up was really very good, sir, by Professor Bellari, sir, our General Secretary of the station, as well as a distinguished scientist in IIT Mumbai. So all this was to develop interest, especially for the younger generation, to attract themselves towards the science and technology and the developmental issues which we are mentioning, and we want to take, I mean, the India wants to take it ahead with its all drawbacks which is going on due to the several war and other things and the Kashmir issues and all those things. Even after this, our technological development are the landmark, and we have achieved so many things that gives us the sense of accomplishment. So at this stage, I must say that जो मुकाम हासिल कर लिए हमने, जो मुकाम हासिल कर लिए हमने, वो तारीफ काबिल है. जो मुकाम हासिल कर लिए हमने वो तारीफ काबिल है, पर वो भी सफर के हिस्से थे, पर वो भी सफर के हिस्से थे, मंजिल तो अभी भी दूर है. So we'll have to do a lot for achieving our goal towards the self-sufficiency in the field of science and technology and technological advancement. But we have done certainly many things, and India must be proud of its achievements. Thank you very much. Thank you to all for sparing time from their valuable schedule. Thank you. Jai Hind.
Thank you very much, sir. And now we close this session and request to you, thank you with regards. Thank you very much, and to kindly allow us to close this session.
Thank you, Santosh, for organizing this, and to Neeraj.
Thank you, sir.
Thank you. मैडम मंजू शर्मा जी, मैं अभी वो रिपोर्ट आपको भेजने वाला हूँ.
अच्छा ठीक है, भेज दीजिए.
थोड़ी देर में भेजता हूँ. ठीक. नमस्ते.